Well, to a CTV News exclusive now, for several years, Penny Daflos has been exposing the many millions of dollars flowing to private staffing agencies. Those agencies provide nursing staff and other medical professionals to BC hospitals and care homes at a steep profit. And nowhere is the problem more acute than in the Northern Health region. The government has insisted it's working to get a handle on the problem, but as Penny shows us tonight, the numbers are growing once again.
When British Columbians go to the hospital, nurses provide professional care, so there's no way of knowing who is paid by government versus a private staffing agency.
It's a trap for the healthcare system.
CTV News has learned the trend of outsourcing nursing shifts to contractors has increased for the 5th straight year, with Northern Health shelling out the most.
We need to invest in the people that are delivering the care, not investing in for-profit business people that are frankly exploiting the situation.
Last year, CTV News waged a 7-month Freedom of Information battle to obtain the contracts that showed just how big the markups are.
I would call it a parasitic industry because they are really benefiting from the severe shortages we're seeing.
The health minister of the day insisted they're a last resort to keep hospitals open, and recruitment of full-time unionized staff is the goal.
Agency nursing is not what we want.
The Ministry of Health points out the rate of increase has slowed, which is true, but in the past 2 years, $500 million was paid to for-profit companies contracting some of the same nurses to the same hospitals, but for higher pay, without forced overtime, and for hours of their choosing.
If health authorities and government are willing to spend this kind of money on for-profit, private nursing services, then why wouldn't we want to invest in the nurses that are already here in British Columbia that frankly have been holding up the system for a number of years?
There is no easy way out. Because when you look at the workforce, we have more nurses per person in BC now than we had pre-COVID. So it's not that we don't have nurses. The only reason is dysfunction. But that dysfunction is not going to be miraculously solved by agency nurses.
Expect those numbers to prompt even more scrutiny on how the health authorities are allocating their budgets. The province is in a significant deficit and looking for areas to slash costs. But with ER closures continuing across the province, they'd essentially have to choose between balancing the books and turning away patients. Penny Daflos, CTV News, Vancouver.